Welcome to the Amber Dazzle Show. I'm so excited to have you on my sets today, and you are tuning in, and with me is my lovely host, Dr. Saba.
Hi Amber, how are you?
Dr. Saba, what are we going to be discussing health-wise today?
I decided to talk about non-alcoholic fatty liver disease. It seems like to be a long name, but the small, quick name or a nickname for that is fatty liver. I see that very commonly in my practice, pretty much on an everyday basis.
Fatty liver, what are the signs and symptoms of liver disease?
Fatty liver usually does not cause a lot of signs and symptoms. Usually people complain of fatigue, maybe a little bit pain in the right area where the liver is, as well as some weight gain, and probably a little bit of abdominal fullness, that's all.
Okay, so if people feel abdominal fullness, how would you diagnose such a patient? What would you do in diagnosis?
Well, fatty liver disease is a very common complaint, and all around the US as well as all around the world. Whenever you gain a little bit of weight, and especially when you are aging, you can actually deposit all the fat in the liver, and that can cause the fatty liver, which actually usually is diagnosed by blood test. It's usually diagnosed on an incidental blood test when you go to your physical and doctor does the test and tells you your liver enzymes are abnormal. That's when we figure out that there is something going on in the liver, and most likely, if there is nothing other, anything else going on, then it's a fatty liver.
Oh, wow.
And once we diagnose you with abnormal liver enzymes, then we normally go for an ultrasound, and ultrasound can tell if the liver is enlarged, as well as by CT scan, MRIs, as well as there is FibroScan. That's a newer technology available to diagnose and assess the severity of the fatty liver, as well as with a liver biopsy, which is usually done in a very rare cases by a specialist.
So now, Dr. Saba, you're mentioning all these tests, like if you go to a doctor for a physical, and that's when you would, the doctor would order a blood test and the further testing. But as a layman, like if I'm sitting at home, how would I feel that I have, would there be any signs and symptoms for like sitting at home? Like what would I really feel? Bloating, fullness, you said, what else? What would be the normal feeling of a patient?
Fatty liver, usually it's a painless condition.
Painless, okay.
You really
you won't experience pain then?
You do not normally experience pain. It is an incidental finding on the routine blood test.
Okay.
But anybody who's gaining weight, a little bit of gain weight, 5 to 10 pounds, if they are thinking that they are overweight or they're obese, or if they have diabetes.
Yeah,
I mean, everybody who's diabetic, patients with high cholesterol and high abnormal cholesterol, actually the bad cholesterol, the triglycerides and the LDL, people with sleep apnea, people with polycystic ovarian disease, people with other metabolic conditions like metabolic syndrome, thyroid conditions. When people have underactive thyroid or hypothyroidism, they're also at a risk for developing fatty liver.
Okay, so what are the treatment out there for if people are experiencing this kind of symptoms? What do they do?
Well, fatty liver, basically it explains itself. It's the deposition of fat in the liver. So the treatment, again, it's tricky.
Okay, diet and exercise?
It's basically losing weight. When weight gain causes fatty liver to develop, weight loss is going to improve the size of the liver, as well as the size of the liver, as well as the liver enzymes. So weight loss is number one, again, with a balanced diet, with exercise, with controlling your hormones. If your thyroid is out of control, it's abnormally low, then the treatment of the hypothyroidism is going to improve the fatty liver as well. If you have high cholesterol, then the treatment of cholesterol medications is going to help you with controlling the fatty liver, as well as monitoring while you are trying to lose weight and while you're trying to treat the fatty liver. So in other words, fatty liver can be actually very dangerous. And people do not realize this. People usually come to me and say, hey, yeah, doctor told me that I had fatty liver a few months ago or a few years ago, or I had some abnormal liver enzymes, but I don't know, maybe they are still abnormal. But I want to tell all my viewers out there, it is scary, it's dangerous. The newer researches that are coming along, they are actually telling us that fatty liver is progressive. And it can progress into hepatitis, that is inflammation of the liver or the swelling of the liver, which in return, if it is not prevented and it's not treated, can turn into cirrhosis, which is worsening of the liver problem, as well as it can lead into liver cancer, which is pretty scary. And anybody who do not drink alcohol, who do not have any medication or a condition that is causing the fatty liver, it is basically called non-alcoholic fatty liver disease. It is more common in people who do not drink alcohol, who do not have any liver infections, but they still have fatty liver. So it means that weight loss is not only causing you to be looking big or looking obese or overweight, it is actually a disaster for you inside your body as well.
Okay, so Dr. Saba, I mean, this is such a great insight to fatty liver. I mean, weight loss not only helps you fight this disease, but diabetes, blood pressure, so many medical conditions out there.
Absolutely.
Is there anything else you want to mention to our viewers about the treatment part that you were saying before?
Well, fatty liver, usually there is no treatment available. Up until now, there has been some few supplements that have come out that are showing very promising results, that are modified form of the omega-3 fatty acids, in other words called fish oil. And we are seeing some great results with that. So anybody who suffers with fatty liver disease, please call my office, 817-510-9645.
Thank you.
And we would love to take care of you.
Thank you so much. And we will continue to see you again in 2 weeks. So stay tuned for Amber Dazzle.